Abdominal anatomy. Start from lower border of the diaphragm and extended up to superior border of inguinal and a pubic ligament. Divided into four quadrants, that is right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant, and into nine region, that is right hypochondric region, epigastric region, left hypochondric region, right lumbar region and umbilical region, left lumbar region, right iliac and hypogastric region and left iliac region. Fact: skin for scare stay dilated when and recess, and inspect abdomen for symmetry, counter or any bulges. Observe counter of the umbilicus to look like a sign of a inflammation and a hernia. Examination with the stethoscope. Gently listen. Sound of bowel on each quadrant. Now you can palpate percuss the abdomen area by this finger placing here like that. That's right. Now we are going to palpate the each four quadrant by pressing this hand like this. Put your hand finger like this one and press here. Palpate this area each quadrant and deeply like this. So I can press like this one. Press on the abdomen and palpate last long on the painful area. Moving smoothly, palpate all quadrant and observe any tenderness, increase resistance to our hand. Precrossing the lever on the mid clavicular line like this one. Palpate the lever, please lift the hand on the thorax. This is a 11th and 12th rib border. I can pull gently upside, yes, and put the right hand on the epigastric area. So, and ask the patient to take a deep breath. Can you take a deep breath for me? Good. Good. We are going to examine the spleen. So I put my left hand on here and press it upside and palpate with the hand. Can you take a deep breath for me? When a patient take a deep breath, feel the spleen when it come down with a fingertips. Ask the patient to turn right side with leg somehow flexed to the hip so we can also properly palpate. Precoce the spleen for the splenomegaly. Precosing left lower anterior chest wall. By precosing spleen, we can come to know that turbus spaces are present. Turbus space is a crescent shape space encompassed by the lower edge of the left lung, and anterior border of the spleen, the left costal margin, and the inferior margin of the left lobe of the liver. To palpate the kidney, put the right hand behind back of the abdomen and just parallel to the 12th rib. Put the left hand on the left upper quadrant, lateral and parallel to the rectus muscles, and ask a patient to take a deep breath and just carefully examine and observe the kidney. Examine the abdominal aorta. Here you can palpate with the see the, what is this pulsation. So we can start. Can you take a deep breath for me? While examination of the aorta, ask the patient to take deep breath in and out. To assess the aorta, press the upper abdomen slightly left of the midline and feel for the aorta pulsation. Try to estimate the width of the aorta gently. And palpitate the fist. So like this one.